segment is sponsored by VCU Massey Cancer Center.
We're joined by Dr. Leslie Randall, Director of Gynecologic Oncology with VCU Massey Cancer Center. Doctor, it's great to see you today.
Great to see you again. Thanks for having me on the show.
Our pleasure. This is an incredibly important conversation, and we've learned over the past several decades that research from cancer centers just like Massey Cancer Center makes such an incredible impact on the trajectory and journey that folks have with their cancer experience. How is cervical cancer typically treated? That's one of the areas of specialty that you focus on.
Yeah, thanks for letting us talk about cervical cancer today. September is Gynecologic Cancer Awareness Month, and cervical cancer is a problem across the U.S. and in Virginia, so it's an important topic for your viewers. Cervical cancer can be prevented with a vaccine that you can get as early as 12 years of age, 11 years of age at the pediatrician's office. But not everyone has access to that vaccine or was old enough to get that or young enough rather to get that vaccine. Pap smears and HPV testing is our second line of defense, but for women who do unfortunately get cervical cancer, there are three categories of treatment. One, they come in the early stages and they can have surgery. Two, they come in more advanced stages, but the cancer is still sort of limited to the pelvic area and they can have radiation treatments. Or unfortunately, sometimes the cancer has spread into other places into the body and they call that metastatic disease, and then that's treated with chemotherapy.
So it's incredible that there are options, certainly at those different stages that would be explored. With a cancer research center like VCU Massey Cancer Center, there are new therapies that are discovered. Are there new therapies that you're focused on right now?
You know, that's a really great question. And unfortunately, even at centers like Massey and centers across the world, there really aren't very many new treatments right now for cervical cancer. Our biggest breakthrough in treating our locally advanced tumors was in 1999. Our last breakthrough in treating metastatic disease was in 2014. What's coming on the horizon is immunotherapy. So we have one immunotherapy that got what's called an FDA accelerated approval in 2018. And what accelerated approval means is that we have early evidence that it's effective, but we don't have solid proof yet. And we don't have we don't have a solid final approval from the FDA to use immunotherapy. And so at Massey, we have new trials at every stage of all those different stages of cancer looking at immunotherapy for this disease.
And so when you mentioned those trials at VCU Massey Cancer Center, these are clinical trials, and you're actively seeking folks to be participants in that. Talk us through the benefits. Talk us through the benefits for both patient and for the cancer center.
Yeah, I'm so glad you're asking this. I could talk about this all day long. I think clinical trial is a very scary phrase. I think it feels like you're getting just this really experimental treatment. Some people say they feel like they're a guinea pig if they go on a clinical trial. We do clinical trials every day. Every day we pick some cancer treatment for a patient. Trying out that treatment is in essence a clinical trial. So all a clinical trial really is trying a certain type of a treatment, but doing it under a very formal, monitored, very careful way. And so really a clinical trial is a way of getting very careful, closely monitored cancer care. And so clinical trial should not be a scary word. There's so many benefits of clinical trials. The main one being that if you go on a clinical trial, you might get access to a drug that's effective that you couldn't get off of the clinical trial. So you're getting tomorrow's treatments today, basically. The other benefit is it's really altruistic. You really help the person that comes after you with cancer, and that could be your family and that could be your friend. And then the third benefit is that unfortunately, especially in cervical cancer, we see that women of color our African American women, our Latina women in our community do worse than our white women in terms of survival with cancer. And putting them on these trials actually helps improve their survival. We have, really good data to show that. So many benefits of clinical trials.
That's an incredible perspective and incredible benefit, certainly, of being part of this. Specifically, what trials are happening at Massey Cancer Center?
Yeah, we're really excited about our immunotherapy portfolio that we have. So, I mentioned those 3 different cancer settings, early stage surgery, locally advanced, we call it, who gets radiation, and then the metastatic disease. So we have locally advanced cervical cancer trial. We have immunotherapy in combination with radiation treatment. Very exciting. So that trial is using the drug that has the accelerated approval that I was talking about. So that study will help us get the final solid approval so that that drug can continue to get to women who need it. The second trial is a metastatic trial that also incorporates immunotherapy into chemotherapy. And then the third trial is a really exciting study. It's immunotherapy alone. So no radiation, no chemotherapy, immunotherapy by itself. And this drug has gotten a fast track designation by the FDA very recently, within the last month, because it has shown such promise in cervical cancer.
Incredible things happening with VCU Massey Cancer Center. Thank you so much, Dr. Leslie Randall, Director of Gynecologic Oncology, for making time and bringing us up to speed. We appreciate it.
Yeah, I can't thank you enough for giving us this voice to reach the women in the community. Thank you so much.
It is absolutely our pleasure. And we will be sure to put a direct link so that folks can learn more. Thank you again, Dr. Randall.
Great. Thank you so much.
For more information on VCU Massey Cancer Center, visit masseycancercenter.org. You can give them a call at 804-828-9080 and find them on facebook.com/VCU Massey Cancer Center. Virginia This Morning returns right after this break.